Bassam Redwan. I have proudly served as senior consultant for the thoracic surgery clinic in Lünen for 6 years. The patients are suspected of having a malignant mass in the lung, possibly involving the pleura in the form of pleural carcinomatosis. And due to this, we plan to perform VATS, take samples, and whilst doing this to also implant a pleural indwelling drain. So yeah, this is our plan for today. I will show you the implantation process step by step. So let's get started. To begin our operation, we will infiltrate the area on a local level. We will numb the specific areas that are likely to cause pain, which include the skin, the periosteum that covers the bone, and the pleura surrounding the lungs. We will take every necessary step to ensure that all 3 targeted areas are sufficiently numbed, ensuring that the procedure is not painful at all, regardless of whether it is performed in an outpatient setting, but also now. And here we are at the upper edge of the rib. We will now enter the pleural space and can continue to aspirate the effusion. And now the Seldinger wire will be inserted. It is important, of course, that the Seldinger wire can be completely inserted without any resistance. We widen the channel accordingly so that it is sufficient for our dilator and the introducer sheath. And then we have another small incision here at the front. Then we will carefully tunnel this connection to our Seldinger wire. And there we also see an important component, namely the cuff, so to speak, which also grows into the subcutaneous fatty tissue so that the catheter cannot easily fly out. Now we carefully remove our instrument and then take the dilator, please. So with the introducer, with the dilator, we go right into the pleural space and then we pull this introducer with the wire out. And now the catheter is basically inserted through this introducer sleeve with peel off. We can simply thread it in and continue inserting it. Everything usually goes in smoothly without any resistance. To ensure that there are absolutely no potential loops or complications later on, everything is meticulously threaded in. And then we make sure that everything is really straight. Wonderful, it's already in place. We would now make a simple interrupted suture over it and fix the catheter in place as well. We can also connect the catheter right after we have fixed it, thus completing the implantation. And yes, simply cap on, and thanks to this valve system, it is connected. Now it doesn't shoot out. It's simply a passive drainage system, and now the catheter is fully functional. That's actually it. Finished.